This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Joining me this morning are Doctors Amanda Sherman and Dr. Marlee Greschner, both OB/GYN with Mon Health. Dr. Sherman, good morning.
Good morning.
And Dr. Greschner, good morning.
Hi, good morning. Thanks for having us.
Appreciate you coming on. Of course, yesterday was Mother's Day, so a happy belated Mother's Day to all of you out there. So we're going to be talking about women's health, as you might have guessed, with a couple of OB/GYNs on the program this morning. But before we dive into the topic, we must talk about you for at least a minute or two this morning. So, Dr. Sherman, just because your name's first on my list today, you can go first. Tell us a little bit about yourself, your background, education, and how you ended up working with Mon Health.
Well, I am originally from the Moorfield-Petersburg area of West Virginia and completed my undergraduate degree at West Virginia University. From there, I went to the osteopathic school in Lewisburg, West Virginia, and then finally joined CAMC to do my internship and residency in obstetrics and gynecology there in Charleston. So West Virginian, born and bred, can't seem to leave her.
Yep. Once West Virginia gets a hold of you, we may leave, Amanda, but we always end up coming back. We always end up coming back. That's for sure. Dr. Greschner, how about you?
Hi, I'm originally from Cambridge, Ohio. I completed my undergraduate training at the University of Dayton and then medical school at Ohio University in Athens, Ohio. Then I went on to complete my residency in Columbus with Ohio Health. So not West Virginia born and raised, but neighbors. But my husband and I came over here. He has a lot of family in West Virginia, and my family's obviously very close. So it worked out.
Well, we appreciate both of you coming on the program. And Dr. Sherman, I'll kick this question to you to get started. Mother's Day yesterday when it's at least one day out of the year, the kids and the husband and everybody else takes a moment to appreciate all that moms do. But how often have you heard this from a patient that, well, I've been busy, I got to get the kids to practice and the PTA and this has to be done, and I just kind of forgot or didn't get around to keeping up with my annual checkups and other healthcare needs. Do you hear that quite a bit?
I would say that I hear that at least a couple times per day. It's very true that women always are focusing on their families and their partners, and we always put ourselves on the back burner to take care of others. So,
Dr. Greschner, for mothers out there who are getting pulled in 17 different directions, you've got all these things to take care of and keep track of. How do you make time to take care of yourself?
Yeah, so I think some important things that women can do just to prioritize their own health, just like they are their families. Some self-care things we can talk about. Even simple things such as getting outside for a little bit each day, taking a walk. We talk about, of course, exercise with patients, and it's kind of overwhelming thinking, I don't have an hour or two for the gym, but even taking, a 20, 30-minute walk, meditating, those types of things can really make a difference.
And Dr. Sherman, what are some of the common, I don't know if it's ailments or complaints or issues, but what are some of the common things that you hear from mothers that are across the board, I guess, have a negative impact on their overall health?
Well, I think, again, we have a busy day-to-day life as a mom. A lot of moms work full-time, part-time, while trying to also juggle the schedule of their children and families. And I think then that just leads to being stressed, which then maybe flows over into when you do get home, you don't feel like you have the energy to really cook a healthy meal or to exercise. You just want to kind of unplug and decompress. So I think, really trying to carve out a little bit of time for yourself, at least a couple times per week, to recharge your batteries is important, because you have to take good care of yourself in order to be able to take care of the people you love.
Talking to OBGYNs this morning, Dr. Amanda Sherman, Dr. Marlee Greschner. So what are some of the other proactive steps, Dr. Greschner, women can take to, carve out a few minutes, whether it's, during the day or a couple of hours throughout the week?
So things like I mentioned before, we talked about getting outside a little bit, short bursts of exercise when they can, even things like meditation, yoga, or just finding time to sit down, read a good book. We always think about physical health, but focusing on that time to have to themselves for their mental health too is, I think, really important.
I don't know if this is in the ballpark, but I'll toss it out there. How important is it to get enough rest, Dr. Sherman, get enough sleep at night to be able to keep up with everything and still carve out some time for yourself?
I think that is probably one of the most important things, because if you're not well rested, you do have a harder time, I think, coping with just your day-to-day. And that would have been a great question for Dr. Greschner, because she has a newborn currently and is now back to work, and really she's the poster child for trying to figure out that balance as far as work, home life.
Sleep is everything.
All right. Well, Dr. Greschner, since Dr. Sherman put you on the spot there, how do you make it all work? How do you find time to, get some quality rest?
Well, I think that leaning on your support system is a big part of it. Your family asking for help when you need it, and friends, and of course your spouse. But like Dr. Sherman mentioned, sleep, I think, is one of the most important things, and I don't have it perfect yet. I'm still learning, but I think, asking for help and having that mental, emotional support is a major component.
And Dr. Sherman, I think Dr. Greschner hit on something there. How important is it to reach out for help? Admit that as well, there are many supermoms. Don't misunderstand me, but say, hey, look, I need some help with this, or can you watch the kids for an hour? How important is it to have that support system and then to utilize that?
I think that is key to making everything work. And, I think there was a time when women really did feel more pressure to try to do everything themselves. But I think that maybe is starting to slowly change, and we are seeing more partners get involved with the child care, and there are more stay-at-home dads out there than there used to be. So it's definitely important to lean on those people that are there for you, and they want to support you. So sometimes I think we feel guilty maybe, or like we're failing, but I think that those people really do enjoy being helpful, and they want to see you happy and well.
I've never met a grandparent that says, no, I don't want to see those grandbabies today. Exactly. No, never met one yet. So, hey, we'll continue our conversation. We're talking with OBGYNs Amanda Sherman and Marlee Greschner this morning. It's our Mother's Day show on Mon Health Talk, and we'll continue the conversation right after this here on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests this morning, Doctors Amanda Sherman and Marlee Greschner, OBGYNs with Mon Health. And so far, our conversation's kind of been about what mothers and women can do on their own outside of the services provided, like the services provided at Mon Health. But Dr. Greschner, when it comes to healthcare, obviously, what do moms and mothers and women need to know about what services are available through Mon Health and what services they need to be taking advantage of?
Yeah, well, really, we provide care for women ranging from adolescence to menopause. So, first focusing on, well woman preventative care or annual exams is kind of another term we use. That really focuses on a lot of health screening. So coming in for regular, breast exams, mammogram screening for those who are at that age or high risk, cervical cancer screening, and, looking at things like mood, sleep, those types of things. And then, of course, we see patients for obstetric care, women who are also thinking and are trying to conceive, our current pregnant patients, and postpartum patients as well. And, of course, we provide care for women that are having gynecologic issues in addition to that.
And Dr. Sherman, how does the women's care providers there at Mon Health, how does that play a role in the overall care team that can be provided at Mon Health?
Well, we have a pretty collective group of physicians who are all board certified and are able to perform minimally invasive surgeries, working alongside of advanced practice practitioners. We have physician's assistants and nurse practitioners here in the office that work closely with us. So even if we're at the hospital, we have folks that are here seeing our patients, making sure that they have access to us. And then when you are in the hospital, you will be seen daily by a physician. You have a very close relationship with your labor and delivery nurse. That is typically one-on-one care when you're a labor patient. So I think we have a pretty seamless transition between office and hospital, making sure that our patients always have access.
I'd be remiss if we did a Mother's Day show and didn't spend a few minutes discussing the Family Birth Center. Dr. Greschner, can you describe the Family Birth Center and some of the services that are offered?
Yeah, so our Family Birth Center, we provide courses for our pregnant patients. So there are classes regarding both labor and delivery. There's breastfeeding classes as well. And baby basics, kind of like Baby 101. Our nursing staff there will give tours to patients as well, so they can actually see the birth center before they come for labor and delivery, see the rooms. Patients will labor and deliver in the same room that they will stay in their postpartum course. So it's all, centralized, and try to keep the same kind of care team, the same nurses throughout their stay as possible. So yeah, that's kind of a quick look at things we can provide to them.
And Dr. Sherman, I use this analogy quite often when discussing, different topics and different services with physicians at Mon Health. Once you have, in this case, if we're talking about the birthing center, once the baby's delivered, you don't just send mom and dad home and go, all right, good luck with that. We'll see you in a year or whatever. The services continue and the follow-ups continue. The care continues even after delivery, obviously.
They certainly do. So we make sure that the patient is very educated prior to their discharge, and they go home with a nice booklet of postpartum education, as well as how to contact us if they're having any problems once they do leave the hospital. And from there, we are very fortunate at Mon to have something called the P3 program, where if moms are struggling with some postpartum depression or baby blues in those first few weeks going home, they have access to Jennifer Bender, who's a registered nurse that works with tracking these moms, checking in with them, making sure that they're able to take care of themselves, take care of their baby. And she has been really kind of key in helping identify any patients that maybe need to be seen earlier than their routine 6-week follow-up appointment.
Yeah, we've spoken to her a couple of times. She's now what I would consider a friend of the program. That is a tremendous program and a tremendous service to offer. Do you find that are mothers now more more open to asking for help and realizing that they're not alone with some of these issues. And that's one of the things I've heard through those discussions that before mothers might go home and not want to ask for help because they thought it was embarrassing or shameful or whatever the case may be to not have it all figured out. But has that attitude changed?
I would say that it has. I think there is less stigma as far as going home with a newborn and feeling overwhelmed and feeling like, well, I'm just supposed to be natural at this and it's just supposed to be an easy thing. That couldn't be farther from the truth.
Dr. Amanda Sherman and Dr. Marlee Greschner joining us, OBGYNs with Mon Health. It is our Mother's Day show. I'll always ask each of you, Dr. Sherman, again, because your name just happens to be on the top of the list today, what do you want mothers to take away from our discussion today?
Take care of yourself so that you can take care of others, and come see us here at Mon Health for your OBGYN care.
And Dr. Greschner?
You're doing a great job, and ask for help.
Is it that simple? Just ask for help? Is that like the most crucial but simple piece of advice you give mothers or women when you're talking to them?
It is one of the biggest, pieces of advice, just remembering, because I just am still fresh in this and literally going through it, and just, telling yourself that you're doing the best, you're the best parent for your baby, and it's okay if you need support.
Dr. Greschner, was this your first Mother's Day?
Yes, it was.
Oh, okay. Well, I would have had the applause queued up had I had that. So did you get brunch or something out of the deal, or how did you celebrate?
Yes, my family came and we went to brunch and celebrated with the new little guy.
Very good. And what about you, Dr. Sherman?
Well, I have a 6-year-old son and a 3-year-old son, and we had just a great day having lunch and playing basketball outside. And my sons reminded me first thing this morning, though, that Mother's Day was over and they didn't have to listen to me anymore.
That was a one-day deal.
One day.
Well, Dr. Sherman, Dr. Greschner, thank you very much for coming on the program. Happy belated Mother's Day to you, and happy Mother's Day to all the mothers out in the audience this morning. Thank you very much, guys. I appreciate the time.
Thank you.
Dr. Amanda Sherman and Dr. Marlee Greschner, OBGYNs with Mon Health, joining us this morning. Of course, you can always get more information. Go to the Mon Health website, monhealth.com/OBGYN, where you can get more information about the care provided there at the Women's Care at Mon Health.